everyone. I'm Aakash Desai, Assistant Professor of Medicine at University of Alabama in Birmingham, and today I'm going to be talking about biomarker testing and fundamentals in non-small cell lung cancer. Here are my disclosures. So essentially, when we talk about patients who have been diagnosed with non-small cell lung cancer, it is very important in this day and age to test for what we call biomarkers or do biomarker testing for your cancer. So a biomarker is any gene, protein, or any other substance that can provide more information about the cancer. Each person's cancer has a unique pattern of biomarkers, and some biomarkers actually affect how certain cancer treatments work and may help us in choosing the right cancer treatment for each patient. Which biomarkers are important for non-small cell lung cancer? Essentially, biomarkers for non-small cell lung cancer fall into two different buckets. One is immunotherapy-related biomarkers, which essentially is PD-L1. What we're looking for is PD-L1 is a protein that is expressed often on the tumor cells, and it may actually impact on the anti-tumor immunity against one's own cancer. So for example, if we look at this cartoon, you see that there is a cancer cell, or also known as a tumor cell, which is expressing this protein called PD-L1. And the way it works is when there is PD-L1 along with our own immune cell, one of the cells called T cells, interacts with the tumor cell through this pathway and sort of switches off our immunity. And so this leads to inhibition of the immune response, resulting in growth of the tumor. Today, we have immunotherapies that can actually inhibit this inhibitory signal and thus helping our own anti-tumor immunity to foster and actually kill the tumor cells. So here's how it works. So for example, when we talk about immune checkpoint inhibitors, what happens is that the tumor cells, as I mentioned earlier, usually turn off the activated T cells through these specific receptors. What these particular immune checkpoint inhibitors do is they actually inhibit this interaction so the immune system or the T cell can be in their on state and actually lead to tumor cell killing. In order to understand how each person's cancer will respond to some of these immune checkpoint inhibitors, we look for something called PD-L1 protein expression. Essentially, this image here shows what a tumor looks under the microscope from a pathology standpoint. And then essentially, we will stain these PD-L1 cells to look at what is the percentage of PD-L1 expression. And we calculate something called the TPS, or the tumor proportion score, which is a percentage, essentially, using the number of PD-L1 stained tumor cells, dividing it by the total number of viable tumor cells, multiplying it by 100%. There are a variety of stains that can be used for this, but essentially this PD-L1 expression is expressed as a percentage, a spectrum from 0 to 100. And depending the higher the percentage of PD-L1, the more likely and the more predictive of immunotherapy benefit in each person's cancer. The second type of biomarker that's very important for non-small cell lung cancer is looking at oncogene driver alterations or actionable genetic alterations. Essentially, what that means is each tumor cell or cancer cell may have a certain genetic aberration which is driving the cancer. It could be a mutation in the DNA with certain mutated genes, which could be leading to tumor formation. It could be fusion of different genes, which then subsequently produce a fusion protein, which is driving the tumor cell growth. And it could be amplifications or activating mutations. All of these downstream leading to cancer cell growth. There are a variety of driver mutations that have already been identified in lung adenocarcinoma. Here's a smattering of these different mutations or alterations that we are able to find and detect in lung adenocarcinoma. And as you see, some of the more common ones, such as KRAS, EGFR, ALK, HER2, BRAF, ROS1, RET, NTRK, MET, are the ones that we typically want to test for, because again, in 2024, we do have therapies that we can target these mutations or aberrations and actually help patients deal with their cancer. What specimens are we using for biomarker testing? So again, it's important to understand the importance of tissue. Tissue is the issue, as we say a lot of times in oncology. So for us, we need to get biopsy, a core needle biopsy or a surgical specimen. The tissue will be then enable us to test for genetic testing with next generation sequencing, looking at all the actionable genetic alterations that I just discussed. There are times where we can use cytology as well, to look at some of these biomarkers that we need to test in this day and age.